Let me start at the beginning. I was working with the health department, and we began to notice increasing numbers of folks being diagnosed with HIV, and there really was no place for care here in town. So we decided to start an early intervention clinic, and we got some funding for it. That was in 1990 when we opened the early intervention clinic. It was Dr. Steve Zell and I, plus really wonderful people at the health department, Wendy Pappas, and among others. And so we budgeted for 50 patients the first year, and 100 people came. So it was very clear that we needed a much bigger facility. So it was a community engagement process, basically, run through the School of Medicine, where I'm a faculty member. And we gathered all the stakeholders from this area. And some of the data that had just started coming out was that outpatient management of HIV was hugely less expensive than hospitalization. So the hospitals were really, really interested in helping us create this outpatient facility. So out of this community engagement process, HOPES was born. And we set up shop, our very first little tiny bitty HOPES clinic, right across from what was then Washoe Medical Center, across from the park. We had 2 exam rooms, a little room in back, a really tiny little front room, and that's where we started seeing patients with HIV and AIDS. So that was in 1997 when we started seeing patients, got bigger, started moving over here, got Hope's House. And then there was a windfall at the legislature. And so it was proposed to take $1 million and split it equally between the North and the South to provide bigger clinical space. And so we bought the building that was here on this site. Is like a U-shaped motel that had been converted into dental offices. But we bought it. And so that now we were able to really start looking at a dedicated clinical space. We could expand. We had the pharmacy start. We started doing on-site laboratory work. We added another social worker. Anyway, we expanded. We were able to gather this team together. So it was that was the team-based model of care. This HOPES clinic has been continuously funded by Ryan White monies since the first grant in 1990. And so it's really a remarkable testament to the ability to provide HIV care. Seriously, all the package, the wraparound services. The constant has been growth. It became very evident that we needed a new executive director to think bigger, and so we started looking, and actually that's when Sharon Chamberlain came along.
We started 25 years ago as a small HIV clinic. For years, we had about 600 patients, and that was our core group of individuals that we served. We have grown so much over the years, and in the past 25 years, we've now grown into this beautiful building on West 5th Street and over 12,000 patients served annually. That's almost over 75,000 visits that we have here at HOPES on an annual basis. We could not do that without an amazing, amazing staff. This staff shows up to work on a daily basis with the mission and the values of HOPES in their hearts. They treat people kindly. That's part of our culture. To be kind to each other as well as to our patients that walk through our door on a daily basis. We like innovation and creativity. Adaptability, all of those pieces are part of our values that we embrace and we want to hold as part of our culture here at HOPES.
From the time you walk in the door at HOPES, you feel like, wow, I've entered a place that's really special and unique. And it keeps me wanting to be involved. I get energized by the people that I'm with and the compassion and hope and energy that they bring to this population and to this organization. We have to support organizations like HOPES that are in the trenches, that have the experience, that understand the group of people that need help, and they know how to help them. as this population grows and as we still have a lack of affordable housing, and people are still struggling, and people are still on the streets, people are still facing addiction, people still feel hopeless and like they have nowhere else to turn. Hopes has become one of the top 2 or 3 organizations that they feel safe with, that they can turn to, and they know they're going to get a compassionate ear and actually real world tools to help provide them to move out of whatever they're struggling with into a better life.
Thank you for giving me my life back. To put it, gently, you gave me my life back. Because you taught me how to love again. And that was lacking in my life. To this day, I've learned how to love people because of hopes. Because of the genuine people I've met here. And after you get to know someone for a while, you develop love for them.
We meet people where they're at. And I cannot tell you how unusual that is. So that overarching thought and ethic is that Hopes is there to bring you in and give you care. And people do it without bias. Everybody is welcome with open arms. You just don't see that other places.
I'm really excited about the future for Hopes as our population grows and as money continues to be an issue and housing continues to be an issue, that Hopes continues to look for ways to help in different areas, in different populations in different areas around Northern Nevada. And over the next decade, we can become bigger and be more impactful and continue to support a staff that is doing more for the community than I think anybody else.
We want to thank you for being part of this journey and for celebrating 25 years with Northern Nevada Hopes. Thank you.